welcome to video 19. This is bones of the pelvis and thigh. So as you can see, we are in the gym today, but for no particular reason other than that's where I am today. But luckily we have some bones here, so we have what we need to go through the bones of the pelvis and thigh. So what are we going to do in this video? We're going to take a look at what is the pelvis and what bones make up the pelvis. And contrast that with what is the pelvic girdle, and we'll take a look at all of these myriad of landmarks on the pelvis and pelvic girdle, and we'll take a look at the thigh bone, also the femur, and its landmarks, and a couple of other things too. But so I'll show you a lot of things on the model here. Some of the things we're going to go into the app and take a look at, just because I don't have an entire pelvis here, actually. I only have a pelvic girdle. But also, there are, for instance, we'll look at some differences between the male and female pelvis in the app and things like that, where we want to see a whole intact pelvis to see some of these things. Okay, so let's get started. Our first thing is to define pelvis. So the word pelvis means basin or bowl. So think of a pelvis as this basin, or this rounded vessel that holds stuff. And that's exactly what it does. It holds stuff. It contains and protects the pelvic organs, but also supports the weight too of the entire upper extremity. Skeletal wise, it conveys the weight of the upper body down onto the lower extremities. So it has a protective function, it has a structural function. The bones themselves do quite a lot of blood production also, being the types of bones that they are flat bones. There's a lot of red marrow in there, and so there's a fair amount of blood production that happens there too. So what is the pelvis? So I defined the word, but that doesn't tell us everything. So the word pelvis means basin. The pelvis is made up of the right and left coxal bones, which I have here. So this is a right coxal bone here, and this is a left coxal bone here. They go together something like this, okay? So the right and left coxal bones, these are what you might call your hip, sort of. We'll talk about all that. So right and left coxal bones plus the sacrum and coccyx, which I don't have here. But if the sacrum was here, it'd be where my hand is here. And so that would be the entire pelvis, the right and left coxal bones plus the sacrum and coccyx. That makes up the pelvis. The pelvic girdle, in contrast, is just the right and left coxal bones. Or we could say, the right pelvic girdle or the left pelvic girdle, but it's just the coxal bones. The coxal bones are also called the innominate bones. That's another term for them. Innominate means no name, a bone with no name. These bones, the coxal bones, I usually call them the coxal bones. They, not to be confused with coccyx, completely different. Coccyx is the tailbone, the very end, is beyond the sacrum. The coxal bones are actually made up of 3 individual bones. And so as we go through the landmarks of each of the coxal bones, we'll go through each of those 3 bones separately and take a look at the landmarks on each of those bones. So they have 3 separate centers of ossification in initial development, and so then the bones eventually then fuse and turn into to one solid bone that we see here. Okay, so when we go into the app, we'll look at the whole pelvis with the sacrum and coccyx, and we'll look at some features of the pelvis. So we're going to skip that part right now, and we'll look at that when we can see the whole pelvis. But for now, we are going to look at some of the features of the whole pelvis we can see on a single coxal bone. Let's look at the right coxal bone, because that's probably what your drawings are that you're looking at in the book. So, and if you can pull up the app to look at this, 3-dimensionally while we're doing this, that would be a good idea too. So a couple of features, let me get this a little closer to the camera here, that you can see. So this, again, is a right coxal bone, okay? And so one of the things you can see here is the acetabulum. The acetabulum is the hip socket. That's where the head of the femur fits in to form the ball and socket joint of the hip. The term acetabulum means wine cup. So suppose if you wanted to pour some wine into it, I don't know. You could. Anyway, so, but the acetabulum is considered one of the features of the entire pelvis versus a feature of any of the individual bones that make up the coxal bone, because the acetabulum is where the three bones of the coxal bone come together. So let me name these three bones here. We have the ilium, which is the bone that makes up the top part. We have the ischium, which is the bone that makes up most of the lower and posterior aspect, and then the pubis, which is the bone that makes up the anterior part. So those three bones come together right here to form the acetabulum, which is the hip socket. So that's considered a part of the entire pelvis versus a landmark of any of the individual bones that make up the coxal bone, the acetabulum. Another thing like that that's considered a feature of the entire pelvis is the obturator foramen. So the obturator foramen, so we see that term foramen, which means hole. We've seen that a lot already. The obturator foramen is a big hole in the pelvis. But mainly in the pelvis, why we have an obturator, why we have a hole here, is to lighten up the weight of the pelvis, but also to create a lot more surface area for muscle attachment. And we'll see when we see the deep lateral rotators of the hip, they go every which way around here to help to stabilize the hip. Okay, let's see. Any other features of the whole pelvis that we can see? I think the rest of them we need to look at the pelvis all together to see those features, because it's a coming together of the whole thing. Okay, so let's take a look at one coxal bone, and so we'll go through bone by bone and take a look at the landmarks on each bone. So this is the right coxal bone. So on a body, it's right here. So so if you grab your hip like this, if you do the same thing here, you're grabbing like this, right? So this landmark right here, which we'll name in just a second, is right here on your own body. Easy to palpate, easy landmark to orient yourself to. So the bone orients about like this in the body when you're standing or whatever. So the three parts of the coxal bone. So let's start with the upper one, which is the ilium. The ilium is the highest part of, most upright part of the pelvis. It's going to look a little different on a male pelvis than it is on a female pelvis. This model that I have is a male pelvis, so we're seeing a very upright ilium here. In a female pelvis, it would be more flared out. It would be, maybe kind of more like this, not so upright. So some landmarks of the ilium. So this one that I pointed out before is the anterior superior iliac spine. So we're going to see a lot of spines on the pelvis. Spine just means a part that sticks out. So anterior superior iliac spine, easy to palpate on your own pelvis. Anterior superior iliac spine. Below that is the anterior inferior iliac spine right here. Anterior inferior iliac spine. So if we're looking at it from the front, it's a little harder to see. We can see the anterior superior iliac spine. Anterior inferior is harder to see from an anterior view. If we are looking from a lateral view, we can see it just fine. There it is, the anterior inferior iliac spine. So these are both places where muscles attach. Remember that a whole lot of why we have landmarks on bones is because muscles attach there, and every time that muscle contracts, it pulls on the bone and stimulates bone growth and creates a growth there, and so then we name that growth, and now we know where that muscle attaches. So anterior superior iliac spine, abbreviated ASIS, anterior inferior iliac spine, abbreviated AIIS. Then we have the iliac crest, which is another landmark that's easy to palpate. You can follow your own iliac crest around, and you should be able to feel it all the way around to the back here. So the iliac crest is the top of the ilium, and then it goes back here to the posterior superior iliac spine. So that's right here. posterior superior iliac spine, and then we have the posterior inferior iliac spine here. So again, if we're looking posteriorly, the superior spine is pretty easy to see, the inferior spine less so. If we're looking laterally, we can see them both pretty well. This is the posterior superior iliac spine, posterior inferior iliac spine. Okay, let's see. What else on the ilium? We have the greater sciatic notch right here, the greater sciatic notch. And that is one thing that is shaped a little bit differently on a male pelvis versus a female pelvis. Although in the app, it doesn't look super different. But if we had real bones here, you'd notice a difference. It's a broader, it's more open in the female pelvis. It's kind of a tighter angle in the male pelvis. Let me check. What am I forgetting here in the ilium? So let's see. Iliac tubercle, okay, I totally don't even know what that is. Anterior, posterior, and inferior gluteal lines. The gluteal lines are not easy to see, and I'm not going to worry about them too much. They do indicate where the gluteal muscles attach. So there's one here, there's one here, or there's one like here and there's one here. They're difficult to see, they're impossible to palpate, so that's not one that I'm going to test you on. But those are on the outer surface of the ilium. And greater sciatic notch, iliac fossa. Oh yes, iliac fossa is important. The iliac fossa is this whole inside part of the ilium. So again, here's our anterior view. If we turn to have a medial view, it's this whole inside part is the iliac fossa. So there is a muscle that essentially fills that whole fossa in called iliacus, appropriately enough. And so that's the iliac fossa. And then the last landmark on the ilium is the auricular surface. And can you see that this kind of looks like an ear? It's a little hard to see, I think, but this is the auricular surface. Auricular referring to ear, it's kind of ear-shaped. The auricular surface on the ilium is where the ilium articulates with the sacrum. The sacrum also has an auricular surface on it, so those two surfaces look like each other. They come together and they form the SI joint, the sacroiliac joint. Okay, so that's it for the ilium. Let's move on to the ischium. So the ischium is the inferior and posterior aspect of the coxal bone. So let's look at this lateral view. So right about here is the transition. So it's ilium up above here and ischium down below here. So here's our first feature of the ilium, which is the iliac spine, ischium. This is the ischial spine. Again, a place where muscles attach, the ischial spine. And below the ischial spine is what's called the lesser sciatic notch. So we have the greater sciatic notch, that's part of the ilium. The lesser sciatic notch is part of the ischium. And then below that, we have the largest landmark on the ischium, which is the ischial tuberosity. So the ischial tuberosity is the common attachment for the hamstrings. These are your sits bones. So if you're sitting on a seat and you have bones, you know, that you're not like slouched down, but you're sitting upright and you can feel the bones that you're sitting on, those are the ischial tuberosities. Okay, large landmark there, ischial tuberosity. Then we have, kind of stretching forward from the ischial tuberosity, we have the ischial ramus. So remember that the term ramus means bridge. So there's a bridge here, in essence, from the ischium, this posterior bone, to the pubic bone, which is the anterior bone. So this stretch of bone is considered a ramus or a bridge, but it's made up of both the ischium and the pubis. And so, again, this division is about here. So from here this way is the ischial ramus, and from here this way is the inferior pubic ramus. Okay, so let's go on to the pubic bone. So the pubic bone, let me get the other coxal bone here. So if we put the right and left coxal bones together, and we make the pelvic girdle, okay, like this, there should be a little space between the two pubic bones. So see that little space right there? So there's a disc that fills in there. There's a joint that's made between those two pubic bones, and that's called the pubic symphysis, or the symphysis pubis. And there's a disc there that fills in. So for instance, and so that disc is, you know, it's like the discs in a lot of ways, the intervertebral discs, where part of its job is just shock absorption. It would feel really, really bad if you had bones bouncing together here in the pelvis. And so, to cushion every step and every jump and all of that, we have this nice disc in between those. So the joint that's formed there is called the pubic symphysis, and then so there's a surface where the disc articulates with each of the pubic bones, and so that is a feature of the pubic bone, is that surface that forms the joint. The pubic bone is this anterior, it's the smallest of them, it's this anterior part. This part right here is the body of the pubic bone. We already looked at here is the inferior pubic ramus, and so let me just reorient. We're looking at a lateral view here of the right coxal bone. So body of the pubis, inferior pubic ramus, this is the superior pubic ramus up here. Okay, so superior pubic ramus is the part of the pubic bone that reaches up to articulate with the ischium, and then, with the ilium, and then the inferior pubic ramus is the part that reaches back to articulate with the ischium. But remember, these are fused, and this is the kind of fusing that happens, I'm trying to remember at what age. I want to say for sure by early 20s, but it might fuse well before that. I'm not sure off the top of my head, actually. If we have the two pubic bones together here, they would be something like this. You might be able to see on one, there's a pubic tubercle, which is just like a rounded bump at the tip there of the pubic bone. And if we get the two of them together, there is kind of a line that forms across here that's called the pubic crest. So the pubic crest is essentially, is more or less a feature of the two pubic bones together. But anyway, that's the pubic crest. Let's see if we even have that on. Yes, pubic crest is on here. Body of the pubis, symphysial surface. That's the surface of the joint where the disc articulates. Pectineal line we're not going to worry about too much. One of the adductors, pectineus, attaches there. The pectineal line is right here. It's just like a specific line on the superior pubic ramus. Let's see. Okay, that's it for landmarks on the pubic bone. I don't have a sacrum and coccyx with me, but we'll look at that in the app. But we looked at that a little bit when we looked at the spine. Let's take a look at the landmarks of the femur. All right, again, let's do right femur, because that's probably the diagram you're looking at is a right femur. Okay, so we're going to notice that, let me just say one more thing about the pelvic girdle. So to help keep clear in your mind about the difference between the pelvis and the pelvic girdle, the pelvic girdle is analogous to the shoulder girdle. So the shoulder girdle is just the clavicle and the scapula. The shoulder girdle is part of the appendicular skeleton, whereas once it articulates, is part of the appendicular skeleton. The shoulder girdle doesn't have any part of, it does articulate with the sternum, so it does articulate with the axial skeleton, but the shoulder girdle itself is just the scapula and the clavicle. So same thing with the pelvis. The pelvic girdle is the thing, it's like the bridge between the axial skeleton and the appendicular skeleton. The girdle itself is considered part of the appendicular skeleton. It articulates with the axial skeleton, so it articulates with the spine, specifically at the sacrum. So it does articulate with it, but the pelvic girdle itself is like this connection between the axial skeleton and the appendicular, well, the axial skeleton and the extremity. It's, you know, kind of a bridge between the axial skeleton and the extremity. Okay, so now we're looking at the lower extremity, but we're looking at the thigh bone, so that's the upper part of the lower extremity. And we're just going to look at the femur and the patella today, and then in another video we'll look at the lower extremity. I mean the lower part of the lower extremity. So the femur. So we're going to find that the femur is analogous in a lot of ways to the humerus, of course. And so, oh my gosh. Okay. So let's find features on the femur, and we'll notice that a lot of those are really similar to features that we know on the humerus. So, and because of that, you're going to be able to tell me what a whole lot of these features are called. So you know the name of this rounded structure at the proximal end of this long bone that articulates with the acetabulum to form the ball and socket joint of the hip. What would that be called? Of course, that would be called the head of the femur. That's the head. The narrow part that comes off of the head is called the neck. I don't know if we labeled that on the humerus. The neck of the humerus is a lot less. It's more subtle than the neck of the femur. The neck of the femur is very clear. It's this definite. You know, the head has a definite distance from the next part of the bone. Actually, the neck of the femur is a common place where the femur can fracture. So often when you hear about a hip fracture, oh, this person fell and broke their hip, usually it's the neck of the femur that breaks. And usually what happens is they break their hip or they break the neck of the femur and fall. I mean, sometimes they fall and it's the impact that breaks it, but usually it's like a hard step or something like that. They stumble and step hard and that breaks it and then they fall. Anyway, that's like, for instance, someone with osteoporosis, that's not uncommon to have a fracture there. Okay, head of the femur, neck of the femur. So remember on the humerus, we had greater tubercle and lesser tubercle. On the femur, we have greater trochanter and lesser trochanter. So this is the greater trochanter. So the greater trochanter you can palpate on your own hip easily enough. It's, you know, if you're getting measurements taken around the hip, you know, to see what your pant size is or your dress size, that measurement is taken around the greater trochanter. So this is the greater trochanter. The lesser trochanter, I'm going to have to rotate it a bit, and here's the lesser trochanter. If we look at a posterior view here, so this is a posterior view of the right femur. So we see the head, we see the neck, we see the greater trochanter, and then we can see the lesser trochanter. So the term trochanter refers to running. And so, like, for instance, the word canter, like a horse canters, you know, before it gallops and other things. So cantering refers to running. So our muscles that deal with running attach to these trochanters. Okay, so greater trochanter, quite a large feature of the femur is the greater trochanter. The lesser trochanter, a much smaller. And in fact, muscles that have more to do with walking attach to the lesser trochanter, whereas muscles that have to do with running have to do attach to the greater trochanter. And then there are, like, there's a crest between them that is called the intertrochanteric crest. And so we can see that if we look at the posterior aspect of the bone here. I hope you can see it between here. There's an intertrochanteric crest. And there's another thing. The trochanteric fossa is this kind of dipped in part here, trochanteric fossa. Okay? There is a gluteal line or gluteal tuberosity, which is right here, which is analogous to the deltoid tuberosity in the humerus. So that is right here. Difficult to see and difficult to feel, but we'll see an important muscle attaching there. And now again here I'm showing you the posterior aspect of the femur, and if you can see it, there's a line that goes down the posterior aspect of the femur. I don't know if I can turn, oh, there you can see it, I think, right there. That's called the linea aspera. So that line goes down the posterior shaft of the femur. A lot of muscles attached there. We're going to see most of the adductors attaching there. We're going to see 2 of the major quads attaching there. So even though this is on the posterior aspect of the femur, quads attached there, adductors attached there. So that's an important feature of the femur. Of course, from here to here, this is the shaft of the femur. That's going to be true for any long bone. And then down at the distal end of the femur, it's a lot easier than the humerus. So the humerus had condyles, but the condyles had specific names, and we had to know those specific names. On the femur, it's nice and straightforward. They're just called condyles. So we can always orient on the femur that the head is on the medial aspect of the bone. So then when we come down to the distal aspect and we're looking at condyles, this is going to be the medial condyle. The medial condyle is the one on the same side as the head. And then the lateral condyle here is of course going to be the condyle that's on the same side as the greater trochanter. So we have the medial condyle and the lateral condyle. And we have the medial and lateral epicondyle. So that's a raised surface above kind of a bump or whatever, above in the area of the condyle. So a medial epicondyle and a lateral epicondyle. We have an intercondylar fossa. You can see this. So in between the 2 condyles, there's a dip there. So that's an intercondylar fossa. And so on this model, the patella, the kneecap here, is attached to the femur, which is not at all how it is. But we have on the, I'm just going to turn, don't try this at home. Do not rotate your patella out of the way. But I'm going to rotate the patella out of the way. And so this surface here, where the patella articulates and kind of glides past the distal end of the femur, that's called the patellar surface on the femur. Okay, let me see. Is that all the landmarks of the femur? Let's see. The head, the neck, the greater trochanter, the lesser trochanter, the trochanteric fossa, the intertrochanteric crest, the gluteal tuberosity, the linea aspera, the pectineal line, we're not going to worry about that, the shaft, the medial and lateral condyles, the medial and lateral epicondyles, the intercondylar fossa, and the patellar surface. Okay, I named them all, yay. All right, let's just take a quick look at the patella, and then we'll go to the app and take a look at the pelvis a little more in the app. So here's the patella. The patella is our kneecap. We do not have a kneecap when we are first born. That has not yet ossified. So if you have somebody who's 2 years or 18 months or younger around, check out their knee. There is no patella there. But then once we start, standing and walking and whatever, then the patella starts to form. The job of the patella is to protect. So the knee we'll talk about more when we get to the lower half of the lower extremity. But the knee, of course, is the articulation between the femur and the tibia. And it is the largest joint in the body, meaning that there is the most space between the 2 articulating bones. So we have to have something that fills in that space, and that is the menisci. So we have a right meniscus and a left meniscus, and I'm totally getting ahead. I just said we weren't going to talk about the knee, and now I'm talking about the knee. The point I want to make is when the knee bends, and again, this is not quite what it looks like when it bends because of how this model is put together. But what happens is the patella comes down here. And so if the knee is in this flexed position, the patella would be located here. Of course I said it's not really attached to the femur at all. The patella is inside a tendon that we'll actually call a ligament once we get down past the patella, but it's inside a tendon. It's the tendon that's formed by the quads. And so the main job of the patella is to protect the knee when it's in a bent position. So if we're kneeling, we're going to kneel on the patella. But this whole, this whole joint is really exposed when it's in a flexed position. And so we have this patella that comes down here and covers up that big exposed open joint. That's the main job of the patella. The patella is a type of bone that's called a sesamoid bone, which means sesamoid just refers to its shape, which means it's sesame seed shaped. But sesamoid bones are unique in that they reside inside tendons. We have sesamoid bones in the feet. We have some in the hands. This is by far the largest sesamoid bone in the body. So features of the patella, it has, if you can see the shape of it, it has a base. So this top part is considered the base. The bottom part is considered the apex. So see how it's a little bit of a triangle shape. So that point at the bottom is the apex. The flat part on top is the base. And then it has medial and lateral facet. Again, I'm going to rotate it, but oh, this is creepy if this happened in real life. I don't know how well you can see this in here. But here and here, there are facets. And those facets just are the places where the bone articulates with the with each condyle of the femur. So everything should, ride very smoothly in there and fit together really well. Okay, so that's it for the bones, at least looking at these bones of the pelvis and of the thigh. Let's take a look inside the app and take a look at the pelvis all together. Okay, here we go. Video 19 in the app part of video 19. Okay, let's take a look at the pelvis here. So let's start out with some differences between the male and female pelvis. So what we're looking at here is a male pelvis. The male and female pelvis need to be different for obvious reasons. Let me add on connective tissue. Here you can see the pubic symphysis, the disc that I was talking about in the pubic bone. You can see that the obturator foramen gets all covered up with connective tissue. And you can see that there is a lot of connective tissue connecting the femur to the pelvic girdle and connecting the sacrum and the pelvic girdle. But let's go ahead and switch to the female pelvis and see how the pelvis flared out and got much wider in the female pelvis. Back to the male pelvis is more upright. So a male pelvis is more upright, a female pelvis is broader. And sometimes those differences look more pronounced than they do in this app, but they are definitely different. Let's see, other differences. We talked about the greater sciatic notch. So see the greater sciatic notch here in the female pelvis? So that's right here is the greater sciatic notch. If we switch to the male pelvis, it's narrower. Again, that doesn't look strikingly different, but it is different. It is narrower in the male pelvis. Let's take off connective tissue. The acetabulum is different in the male and female pelvis. So here we're looking at the male pelvis. When we switch to the female pelvis, keep your eye on the acetabulum. So the acetabulum, and actually don't just keep your eye on the acetabulum, but also the head of the femur. Let's go back to the male pelvis. So in a male pelvis, the head of the femur is deeper inside. So the acetabulum is deeper in a male pelvis, and so the hip is more secure in a sense. In a female pelvis, see how much the head of the femur is not as deeply set in the acetabulum. So the acetabulum are shallower in a female pelvis, and broader, and so that gives the female hips more mobility than male hips have. So the obvious differences between male and female pelvis have to do with childbearing. So this part of the pelvis we're looking at here, we can draw a circle around here. This is the pelvic inlet. So anything above that pelvic inlet, if we look here, anything above this
circle that makes the pelvic inlet is considered the greater pelvis or the false pelvis. So from this line or so up, that's the greater pelvis or the false pelvis. So the majority of the ilium is part of the greater pelvis or the false pelvis. And then below that line, all of this down here is the true pelvis or the lesser pelvis. So the true pelvis, this lower part, so something is considered inside the pelvis once it passes, once it goes past this pelvic inlet. So something, you know, would be inside the pelvis once it passes through that pelvic inlet, and so then the pelvis itself is that section inside, like from, well, it's all pelvis, that's right, it's all pelvis, but here, that's, you know, something would be inside the pelvis if it's in through there. And so if there's a pelvic inlet, however, there needs to also be a pelvic outlet. The pelvic outlet, actually, let's put connective tissue back on because we're going to be able to see this a little better like that. The pelvic outlet, we're looking from below now, the pelvic outlet is here, is that circle. That's formed by the ischial ramus and the inferior pubic ramus and the sacrotuberous ligament here and the coxal bone. That's the pelvic outlet. So something passes out of the pelvis once it passes through that pelvic outlet. So back to the obvious differences between male and female pelvis. In a female pelvis, that pelvic outlet has to fit a head through it. In a male pelvis, it doesn't need to. So here's female pelvis from below. Let's see if we can get a really good view of that pelvic outlet. Sorry, I'm just spinning her around here. Okay, I guess that's as far as she wants to go. Okay, so there's pelvic outlet on a female pelvis, male pelvis. See how the coccyx comes way in on the male pelvis? So here's the coccyx here. So the result is this whole pelvic outlet is much narrower on a male pelvis. On a male pelvis, the only thing that needs to come out that pelvic outlet is like bowel movements. In a female pelvis, an entire head has to fit out of that. So back to female pelvis, see that how much bigger that pelvic outlet is. So again, it's here essentially is the pelvic outlet. And then also on a female pelvis during pregnancy, all of these ligaments that we can see here are going to loosen up significantly, so there's a lot more mobility so that we can move the bones of the pelvis apart and make this whole thing even bigger. Okay, let's see. So we talked about pelvic inlet, pelvic outlet. We talked about some differences between the male and female pelvis. We talked about greater pelvis and lesser pelvis, or the false pelvis and true pelvis. Let me see, is that it? Let me just check my notes real here. Oh, the joints. So we talked about the pubic symphysis. So this is that's the disc right there, but here where the two pubic bones come together, that's the pubic symphysis. That's one of the joints of the pelvis. The sacroiliac joint, let's get rid of our connective tissue again here so we can see it better. Sacroiliac joint is here, so that's where the sacrum and the ilium come together. And then the third joint, let me see what we have listed. We have sacroiliac joint, pubic symphysis, and sacrococcygeal joint. Okay, so officially the joint between the sacrum and the coccyx right here, sacrococcygeal joint, would also be officially one of the joints of the pelvis. But then the other key joint that we have here is the hip joint right here. So that's where the acetabulum comes together with the head of the femur. Alrighty, so that's it for video 19. I believe that's our, let me just look at the notes again, overall shape, size and shape of the pelvis inlet, pelvic outlet, the acetabulum, and the greater sciatic notch. So those were the differences between male and female pelvis. Okay, there we go. Video 19. Next up, we're gonna look at muscles of the thigh. So it's a lot of muscles, but pretty straightforward. And then we'll look at muscles of the hip. So that's what's coming up next. Okay, hope you enjoyed, and I will see you next video.